Neurology questions 3. 14. A nurse is teaching a client with a seizure disorder and spouse about safety precautions after discharge. The nurse would evaluate that the client needs more information if the client states that he or she should 1. Take all prescribed medication on time. 2. Have the spouse nearby when showering. 3. Drink alcohol in small amounts only on weekends. 4. Refrain from smoking alone. The correct answer is 3. Drink alcohol in small amounts only on weekends. 15. A client has had a transsphenoidal resection of the pituitary gland. The nurse notes drainage on the nasal dressing, suspecting cerebrospinal fluid leakage. The nurse would look for drainage that is 1. Bloody with very small clots. 2. Sanguineous surrounded by clear straw color fluid. 3. Serosanguineous only. 4. Sanguineous only with no clot formation. The correct answer is 2. Sanguineous surrounded by clear to straw colored fluid. 16. A nurse reviews a telephone call from the emergency room and is told that client with a cerebral aneurysm will be transferred to the nursing unit. The client is to be placed on aneurysm precautions. The nurse prepares the room for the client and prepares a plan of care. Which of the following would not be included in this plan? 1. Notify the dietary department and restrict coffee and other caffeine containing product. 2. Place a commode at the bedside of the client. 3. Place a blood pressure cuff at the client's bedside. 4. Close the shades in the client's room and keep the lights at a minimum. The correct answer is 2. Place a commode at the bedside of the client. 17. A client arrives in the emergency room with closed injury to the right side of the head from assault with baseball bat. The nurse assesses the client neurologically, looking primarily for motor response deficit that involves 1. The left side of the body, 2. The right side of the body, 3. Both sides of the body equally, 4. Cranial nerves only such as speech and pupillary response. The correct answer is 1. The left side of the body. 18. A nurse is providing instruction to a client with a seizure disorder who will be taking Pinotin. Which statement, if made by the client, indicate that the client understands the information about the medication? 1. I should take my medication before coming to the laboratory to have a blood level drawn. 2. I should monitor for left side effect and adjust my medication dose depending on how severe the side effects are. 3. I should try to avoid alcohol, but if I am not able to, I can drink alcohol in moderation. 4. I need to perform good oral hygiene, including closing and brushing my teeth. The correct answer is 4. I need to perform good oral hygiene, including closing and brushing my teeth. 19. A nurse is trying to communicate with cerebrovascular accident client with aphasia. Which of the following action by the nurse would be least helpful to the client? 1. Speaking to the client at the slower rate. 2. Completing the sentence that the client cannot finish. 3. Looking directly at the client during attempts at speech. 4. Allowing plenty of time for the client to respond. The correct answer is 2. Completing the sentence that the client cannot speak.